I suffered and suffered and suffered until I was sick and tired of suffering. Sounds familiar? Raise your hand if this sounds like you. Funny, I can't really see you, so it doesn't really matter. But guess what? I completely understand you. Because you may deal with quite some time with these conditions like depression, mood disorders, thyroid disease, autoimmune disorders, digestive issues, skin problems, and other general symptoms like pain, fatigue. And those may seem like very different problems, but actually they have one thing in common: inflammation. And that is the root of most of those chronic conditions. Isn't that crazy? Because doctors know that the root cause of these symptoms and conditions that you are dealing with is inflammation. Really? How? Let me explain. If you have eczema, what do we give you? Steroids. That is an anti-inflammatory. If you are dealing with pain, we give you NSAIDs. That is an anti-inflammatory. If you are dealing with allergies, achoo! Not me, you. Guess what? We give you an anti-inflammatory, otherwise known as an antihistamine. Isn't that crazy? Well, not so much. Let me explain. So now, I want you to imagine a tree. Now, where could there be a tree? Oh, a tree! Now, these leaves are the symptoms that you're experiencing. And while most doctors are taught to only address these leaves or symptoms, but here's what's crazy. That the underlying root cause of all of these symptoms is inflammation. And now this is where it gets crazier. Ready for it? Da-da-da-da-da! If you treat the underlying root cause of your symptoms, you can heal not one symptom, but then all of these leaves or these symptoms, and they go all away, like poof, simultaneously, gone. You didn't think I could do magic too. Now the question remains, how are we going to lower the inflammation? And what are we going to do? Well, that we're going to need to talk about next time we get together. Or you can just cheat and pick up my book, check out my website, whatever works for you. I'm not judging. I'll see you guys later.